For the state's foster carers, the pandemic has put additional strain on their emotional and financial capacity. They're having to regularly dip into their personal savings to cover medical bills and other therapies for the kids in their care. And it's made more difficult when they're not able to access Medicare or the appropriate documents. Here's state political reporter Richard Willingham.
Krissy Robinson loves being a foster carer. It's a rewarding experience. There are ups, but there are also downs. It can be emotionally straining and financially draining.
Now, one thing I didn't know about volunteering is that I would be volunteering my bank account.
Like many, Miss Robinson is often thousands of dollars out of pocket for medical and therapy bills. The payments she does receive don't always cover the costs, and reimbursements can be slow. Many foster carers don't get access to Medicare cards easily because kids from child protection don't always have them, and that makes a trip to the doctor expensive.
We randomly got her birth certificate 3 years into having her, but there's people who've had kids for 6-7 years, never had a birth certificate, never had their Medicare card, immunisation records, can't track them down.
A census of Victorian carers found 75% were regularly out of pocket, and COVID has added to the pressure.
Having the children home 24/7 for extended periods has meant obvious increase in utility bills. It's meant increase in food bills. We have carers who have lost their businesses or also faced unemployment. So the financial stress is huge.
Lockdown has made foster care work harder. Critical therapy sessions are now virtual, a struggle for attention after homeschooling.
Personally, some of her behaviours are really scary for me, and trying to do that and have a conversation via Zoom, it just doesn't get to the heart of, for me, how I would feel supported.
I think it's quite an easy fix. If there was more administrative reform, administrative assistance for our carers, that would go a really long way.
Foster carers did receive an extra $600 payment due to lockdown, and recent state budgets have pumped tens of millions of dollars into the system. But what foster carers really want is faster help. Importantly, they want children in state care to be registered with Medicare.
But it is frustrating, there's no doubt about that. And in many ways, that's, dealing with bureaucracy, and I understand that. For carers, they just want to get on to the job of doing the marvellous work they do. We are continually working with the Commonwealth to try and speed that up.
Literally thousands of the most vulnerable kids in the state every year unable to access healthcare because the government hasn't done something incredibly basic and so important, and that is to register kids with Medicare.
There are 14,000 kids in the system in Victoria, and the sector is desperately calling out for more carers. Anglicare alone says it needs 90 families, and estimates across the state 700 are required. Richard Willingham, ABC News, Melbourne.